most of us, when we go to our initial interview at the med school that we're going to matriculate to, we've already written in a personal statement some version of "I want to help people" as the reason for getting asking to be admitted to this moral community of medicine, and being given the privilege of a medical education and entering the profession. And as we go through the cycle of med school and then residency, it seems that a lot of times the idealism that we enter med school with ends up getting trained out of us. And you see that evidence in a lot of surveys that say over 50% of practicing physicians attendings are experiencing symptoms of burnout. And I would say I've probably to a certain extent we all experienced this. I was definitely experiencing that to a great degree when I started initially practicing in the field as a medical director at an opioid treatment program. And what I have found is that the reward that you get from seeing a patient and addressing specifically their addiction, rather than seeing them in the hospital or in OB triage for an issue that is not necessarily related to their addiction, but could be a complication even, it's different because the story that you get is a picture of a whole person who has oftentimes had a disease thrust upon them through their genetics, which I might not experience if I take an opioid, and other people might not experience diabetes if they eat too much sugar, when that's not optimal for their biochemistry. uh, Addiction touches every specialty in one way or another. And I would seriously consider a career in addiction medicine, or to make serving addiction patients a part of one's practice, even if you're not going to choose, a career specifically in this specialty, because of how rewarding it is, how much satisfaction there is from once you get somebody on medication for OUD, month by month, you see them restore their lives. And it's a successful treatment for a good swath of people. It's not like, oh, 1 in 50 of these people are going to get better, as is the case in some of the diseases that we encounter in medicine. But rather you see, a majority of your patients will have measurable improvements in terms of their lives, whether it's getting a bank account, getting a car, getting a license back that they had lost, paying off fines, and completing, something within the justice system that has been imposed upon them because of a criminal activity, um, something like that. It's just beautiful to watch, and you get to be a part of it. I get thanked every day, which, I mean, I'm not exaggerating. Every day somebody thanks me undeservedly, truly, because I'll spend, I meet them for a first time a half an hour. But choose addiction medicine, and remember that everybody should have somebody in their life that they can go to and be completely vulnerable without fear of judgment. That's what you're called to be as a physician in general. And in particular, when you see patients with addiction, you might be the only person in their life that can be that, and it can be transformative for both you and the patient.